you for joining this Snack and Learn webinar from wherever you are in the world at the moment. Before we get into it, just going to remind everyone that we'll take questions at the end of this webinar. So if you do have any questions as we're going through, please just type them into the question box in your GoToWebinar control panel. And we'll get to those at the end. There's also a copy of the slides as a handout in the handout menu in the control panel as well, which you'll be able to access. So today's presentation is on health and wellbeing in the built environment. My name is Ben Gibbs. I'm an associate in the sustainability team in Brisbane in Australia, and today I'm co-presenting this webinar with my WSP colleague Mohammad Abbasi, who's a building performance consultant in our Chicago office. Today we're going to take you through a brief background with the time we've got on health and wellbeing in the built environment, where it's come from, and some rating tools that we use to measure it and that are proving to be popular around the world. We're then going to take you through some very interesting case studies from both where Mohammad and I are located, so our WSP Brisbane office, as well as the University of Chicago and the Colorado Health Foundation. We'll then wrap it up with some takeaways for you all, and then, as I said, we'll get to the Q&A at the end. So a reminder to type in your questions in the question box if any come up as we go through this. So a brief background of health and wellbeing in the built environment and what it is and where it's come from. So sustainability has obviously been a big part of health and wellbeing and the built environment for a long time. And we're seeing this focus to human-focused design, where sustainability is going to focus more on people over the last few years and into the future. So some of this has come from some analysis from a number of the green building councils around the world. This plot here is from the World Green Building Council, which just has a breakdown of typical costs an organisation has over on an annual period. So showing that the vast majority, close to 90%, typically comes from costs due to staff, so from their salaries and benefits. And what this really means is that if we can optimise for improving the experience of staff where they're located, we can see, it's quite a good business case for improving their health and wellbeing. That, coupled with the fact that we spend a significant amount of time indoors, it is roughly 90%. A lot of that is at work. There's a good opportunity for people to optimise their work experience and see some good returns from improving what will be their experience at work. So that's kind of the business case drivers behind why we're seeing many businesses and projects focus on health and wellbeing. The other driver we're seeing is the need from a health point of view. So this is some statistics from Australia, from our Bureau of Statistics, which shows the proportion of people in Australia who have chronic illness, which you can see here. I won't go through them all, but you can see the ones here around cardiovascular. Mental health is a big one in many locations, and approximately 40% of Australians over the age of 45 have 2 or more of these chronic conditions. So we have an aging population here in Australia as well. So we're seeing these health conditions become more and more prevalent, and if we can design our buildings and our projects to try and mitigate against these rises in these health statistics, then that's a benefit for society as a whole. So this is probably the other key driver in this focus on health and wellbeing in the built environment, as it is a key positive and benefit for the employee themselves as well as the business from a return point of view. So what we do commonly is use rating systems to focus on health and wellbeing and sustainability overall. These have come from a range of different places from the Green Building Councils. So some common ones in the US is LEED. Here in Australia, we have Green Star. UK has BREEAM. which are typically focused around more planetary health and building performance. But we're seeing this great rise and push in health and wellbeing focused rating tools now, where the focus becomes human health and health and wellbeing outcomes. So we've got the Well rating tool, we've got Reset, and we've got Fitwell, which are all very specific around health and wellbeing frameworks. And we can see here, just kind of graphically showing the focus of each of these. So as I mentioned, LEED and the green building rating tools from whatever Green Building Council is relevant to your area, largely focused on more holistic planetary health and less on human health, but we are seeing that change. So here we're seeing the LEED 2009, this previous version, with LEED V4 being the more recent version, which has a more prominent view of human health within the credits of the tool. And then we can see the more specific health and wellbeing focused tools being Reset, and particularly Well and Fitwell being heavily focused on human health as a key outcome of achieving one of those ratings. The other move we're seeing in the rating tool space is scalability. So these tools now have the ability to be applied at scale across multiple portfolios. Here in Australia, it's becoming more and more common for the large asset owners who own a portfolio of buildings or assets to apply health and wellbeing strategies at a large scale. And then achieve a portfolio score and benchmarking for a number of assets all at once on an ongoing basis. So we're seeing this become really mainstream here in Australia, which is a great outcome for getting these initiatives into a large number of buildings. The other thing to point out with a rating tool, which may be different to what some people are familiar with as a sustainability or green building rating tool, is these are living rating tools. They're ongoing. They're not accredited at a point of time and then there's no further action. So this little chart here shows the common steps for achieving really any rating. So you've defined your benchmarks and goals, your scorecard, your strategies. You've verified that through the relevant third-party agency, and then you can celebrate once you've achieved your rating. The thing with these health and wellbeing ones is there's ongoing requirements for people to report upon. They typically last 3 years, at which time you need to recertify and go through the process again. So it's a constant update of your strategies, making sure that all the policies that relate to human health are still being implemented, that any other testing requirements for air and water quality are still ongoing. So it's an ongoing process over really the life of a building. The other key point that has happened in recent times is a response to the pandemic, the COVID-19 pandemic. So the leaders in this space, being Fitwell and Well, have introduced specific rating tools related to viral response and prevention of viral infections. So Fitwell have their viral response module and Well have the health and safety rating, which focus on a number of key metrics within the tool. So it's almost a cut down version of the larger rating tool to focus purely on largely operational requirements. So this is for kind of existing buildings in operation. So here we're looking at some key elements really to focus on hygiene and sanitation, the quality of air and water, behaviour change, so all these things that we're now very used to doing, being socially distancing, washing our hands, sanitising regularly, so that will all come part of this. Organisations promoting health services and providing benefits to their staff, and being prepared for emergencies when they do come about. So that's a bit of a very brief background into the drivers between of health and wellbeing and the rating tools we use. I'm going to take you through the first case study now, which is our WSP workplace here in Brisbane. So this is located in Fortitude Valley in Brisbane, which is just kind of one suburb out from the CBD in quite a commercial hub of Brisbane. WSP provided many services on this job, including sustainability, acoustics, lighting, and MEP and hydraulics. And this was completed in March 2019. So we've been in the office for a couple of years now, with obviously an absence last year when we were locked down. We co-located 3 existing WSP offices in Brisbane of approximately 600 staff all together in this one building. There was a number of visions that we had for the project when we started. One of them was to promote and enhance health and wellbeing for our staff. Another one was creating a visible connection to Brisbane's Aboriginal heritage, which is another great outcome, and I won't cover it today, but as you'll see it in the images, is another very interesting part of this project. So a key part of the project was the site selection. Before I get to that, we did target a number of ratings on this project. So we targeted a Fitwell health and wellbeing certification, and we targeted a Green Star interiors rating as well, which we both achieved for this project. And as I mentioned, the location and the base building that we selected was key to a number of health and wellbeing outcomes. So the building itself is located centrally in Fortitude Valley for access to many public transport options, and for people using their bikes or walking to work. You can see there's the outdoor space down below. It's located next to a park and many other parks within walking distance, as well as the Brisbane River. Within the actual design itself, we have the internal stair, which I'll cover off as well. And within the base building, we have the end of trip facilities for many bikes and lockers for people to store their bikes securely, or as well as run at lunchtime and get in their activity throughout the day. So the workplaces themselves are very vibrant areas. You can see the colour difference here, which is out of the Indigenous design elements, which each represent a different cultural element from our Indigenous design team. Ergonomic workstations throughout, so sit-to-stand desks for everyone. The indoor environment quality was a key focus for the project, so ensuring there was plenty of natural light coming through the whole floor plate. Material choices, obviously, in terms of low volatile compounds. The acoustic strategy, so our team worked very hard on designing this acoustic strategy that would provide people with open areas, but well as quiet spaces where they can be isolated from the wider working environment, and outdoor air rates above code, 50% above code, to provide fresh air. As I mentioned, active design was also a key element. So we've got the base building end of trip, but also within the floor plate itself. So we have an internal atrium stair connecting the 4 floor plates here. What we wanted to do as part of the design was really promote this area through a number of elements. One was the Indigenous art, which you can see over in the lift lobby there, to create this really vibrant space for people to want to be in. It's on the facade, so we've got lots of daylight, we've got lots of planting throughout this area as well. So it's been a really great outcome for the office. Lots of people, or all people, really use these stairs to move up and down throughout the office. No one really used the lifts, and it's also a great social outcome as well. Being quite a big office and working in different departments, we do kind of make it difficult sometimes for ourselves to meet others within such a big office, but this really is a place to meet other people, chat with people on the stairs, and compared to our previous office, we have seen a really big uptake in collaboration of people, when people are just stopping to chat and communicate with their with their work colleagues, which at the moment we're fortunate enough to be in the office if we want in Brisbane, so it's a nice change to actually be able to see people and have a chat, given what's happened over the last 18 months. And then finally, the indoor environment. So as you can see more clearly here, the artwork. So these are the lift lobbies, really lovely, vibrant spaces for people to enter the workplace. And then we have more artwork throughout the fit out. Lots of planting, as I mentioned, lots of vibrant colour. So it's a really nice place to spend your work time. So that's my case study. I'm going to hand over to Mohammad now, who's going to take you through another couple of case studies, the first being the Colorado Health Foundation.
Thank you, Ben, and hello, everyone. It's Mohammad Abbasi. You hear me from Windy City, Chicago. So the first case study that I want to talk about is Colorado Health Foundation. Next slide, please. Colorado Health Foundation, located in Denver, Colorado. WSP provided lead and well consulting for the project, in addition to daylight and energy analysis. The project achieved lead and well gold certification back in 2017. This has been a really good example of an organization like Colorado Health Foundation, which is a nonprofit organization that wanted to set an example of how a healthy and sustainable building looks like for the community and the city. The Colorado Health Foundation also advocate for health equity within the community and trying to promote health benefit for all group of people. Next. This project been really trying to make a balance between a sustainable space and a healthy space. And there have been so many highlights in the project that are advocating for healthy environment. As you can see, the building is designed to maximize daylight in the space to not only reduce energy, but also to promote circadian rhythm for the people to make sure their productivity and the sleep quality doesn't go down with working for long hours. Active design for active active design has also been a big priority in the project. As you can see, a really good staircase being prioritized from early in the design to make sure that we are encouraging people to use the staircase with the good design elements, the green wall, and just not having immediate access to the elevator for people. Biophilia, as you can tell, is a big priority in the project as well, not only with implementing the green wall, but also potted plants across the project, bring the element of water to the lobby as well. This is Denver, Colorado, which is home of Rocky Mountain. So connection to nature and biophilic design is a big priority for the community. Other than that, so many other strategies being implemented for the project to make sure that, for instance, in the dining area, we are designing a nice, pleasant dining area that people are getting encouraged to go there to having their lunch instead of having their lunch at their desk, with sufficient space, sufficient light and daylight, and elements of nature in their dining area. The next study is another landmark and a really outstanding project that WSP has delivered. It's University of Chicago Harris School of Public Policy. This project being able to achieve LEED Platinum and LBC pedal certification. WSP has supported the project for LBC red list and eliminating any red list ingredient from the project. It's another aspect of how healthy building could be. It's definitely a way more stringent approach and project that we're going to talk about. The project is located in Chicago, Illinois. The client is a FAR associate, and the building was completed in 2018, and the certification was achieved in early 2019. Similar to Colorado Health Foundation, this project also has a really good balance of sustainability and healthy environment. As you can see, this project also been advocating for active design, having a really nice, well-designed staircase to encourage people to take that and not use the elevator, and encourage people to be more active in the space, have a really nice atrium so people can hang out and socialize and study, and a multifunctional space that's been designed with the reclaimed wood from the neighborhood. In addition to bringing natural materials and elements and texture to across the design. So what WSP has delivered for this project is a little bit unique, and it doesn't happen in every single project. But the scope of work here was to do the material vetting during the design for every single material in the project, from utility equipment to HVAC equipment to architectural finishes, the structure, everything, to make sure that we review the ingredients of all the materials up to 99.90% of in their ingredients, to make sure there's no red list ingredients in that material, which is resulting not only in good air quality, but also it results in minimizing the exposure to toxic material for the people in the space. And through that exercise with the architect and the owner, the project been able to eliminate and phase out so many toxic ingredients in the material of the project. And these red list ingredients been defined by red list in Living Building Challenge certification. So by the time this project happened, still we didn't have many certification out there advocating for healthy ingredient. And when this project was in the design phase, reaching out to manufacturer for their ingredients of their material, it resulted in a couple of like materials like Firestone, EPDM roofing system, to eliminate their toxic ingredients from their material. So this project not only achieve the really healthy ingredients for the material for their occupants, but also help to transform the market and advocate for transparency in the material world, and pushing the manufacturers to eliminate those from their supply chain. So these are a couple of quick takeaways from what's been happening and what is happening now. We know that for a fact, the pandemic helped a lot to raise awareness around healthy buildings, to make sure that people understand that now this is a priority. Certification like WELL, Reset, FitWell been out there for the past 7-8 years at least, but they grew so fast during the pandemic. I mean, right now we have over 26,000 registered WELL project across the world. If we look at the number pre-pandemic, it was a fraction of this project that we currently have. So it's a really fast growing market because of the pandemic and because of the need for healthy building, healthy air quality, healthy materials, and healthy occupants. The other factor about all of this certification, which is unique, is all of this certification, health safety that Ben presented on, Reset and WELL, these are living certification, meaning that none of these certification are one-time documentation, that you do the documentation and you get a label or plaque to be installed at your project. All of this certification, mainly WELL certification, which is the pioneer and the champion of transforming the market for a healthier space, they're advocating for a evolving certification and a monitoring-based certification that not only help you to optimize your design process, but also help you to monitor air quality and water quality of your projects during the operation and make necessary adjustment when is needed. So with that, we finish our presentation and we can move to Q&A section.
Thank you guys for a fantastic presentation. Before moving into the Q&A period, I would like to remind attendees to enter your questions in the question box on the GoToWebinar platform, and also you can download a PDF version of the presentation from the handouts on the dashboard. So we will start with the first question. How do I choose what rating tool to use for my project?
I'll go first if you want, Mohammed. Yeah, I think it's a common question we get, and there's a number of factors within the rating tools. As I kind of was talking about, there's different focuses for each. So it's really you need to take time to work out what the main focus is that you want to achieve as an outcome for each project. Typically here in Australia, we're seeing a trend of lots of interiors or fit out focuses being largely on health and wellbeing. So well and fit well, very common for fit outs and building interiors. Green Star here or LEED more commonly for the base building elements to get, make sure you're still getting the energy and water and waste efficiencies and performance that you want. So that's a trend that we're seeing, but we are seeing more and more Green Star coupled with well at a base building level. So it depends on what outcome you want. Cost is probably one thing we didn't talk about yet, which is another factor. So all of these have different costs from certification point of view, which does impact people's decision making. So it's something to be aware of. Well, for example, has a lot of performance requirements, which does increase the cost, compared to something a bit more prescriptive like Fitwell. So it's really about selecting the outcomes that you want at the start and understanding what you're going to get out of each rating tool before you launch into too far down without understanding that. So anything to add on that, Mohammed?
Oh, that was perfect.
Okay.
Thank you. How can we calculate and measure the benefit of healthy buildings?
Yeah, really good question. I can take that on. It's so it's really important to understand the business case of the healthy buildings. It's common sense. Everyone understand that because it resonates with their concern of health for every single person. But now what has been changed in the past 10 years is now with a tons of research and emerging research that coming out of so many universities in North America, in Australia, in Europe, on how we can measure the impact of air quality, light, on productivity, on sleep quality, on the impact of them on different diseases, on obesity. All of these things are enabling us to measure and calculate return of investment for clients, similar to what we've been doing for years on energy. So what's coming next for the market is similar to exactly energy that we've been telling clients what is the return of investment for adding installation. Now we can tell them what is the return of investment on cognitive function and productivity of the people with increase of ventilation, for instance, which is the clear case. So that's been the biggest game changer to me in the market.
Thank you. Next question. In your opinion, do we still need to consider healthy building post-pandemic?
Well, yeah, I think as Mohammed very well went through, it's been a massive uptake in health and wellbeing as a result of the pandemic. But there definitely was, a drive and a push for health and wellbeing prior to the pandemic for a number of the reasons that Mohammed just mentioned in terms of productivity and health and wellbeing for staff while they are working. So I think we're just going to see it increase more now. I think the pandemic has given it probably more of a spotlight on what the positive outcomes can be and some of the other risks, I guess, that designing with these things in mind can mitigate against. So I think, yeah, it's definitely not going to be something that doesn't happen anymore. I think if anything, it's going to increase, probably significantly beyond the pandemic now, because I think everyone's aware that this isn't, probably a one-time event either, and there's always, from a health point of view, ways that we can help staff and protect ourselves from different aspects and get more out of our workday. So that's going to be something that's consistent for forever while we're still working. No, I think we're going to see health and wellbeing being a key focus of building design for a very long time.
Thank you. Another question for you, Ben. Does the Brisbane workspace have any private space, such as offices or cubes?
Yes, so it's largely a open plan office, but there are a number of areas within each floor plate where there are private kind of workplaces. They're not dedicated offices for anyone, but they're places that people can go. So some of those are bookable for people to book in wherever they want for a time. Others are not bookable, and people can just go in there at different times to get space away. So we've found in the time we've been there, that's quite a good balance, and the number of rooms we have to be well thought out. We did a lot of surveys with people prior to moving in about what kind of workspaces they want. So yeah, we're seeing that work really well. So having them, is quite a large variety of different options for people to work in and out of the open plan office or in different quiet spaces to be really effective.
Fantastic, thank you. We'll take the last question. In your experience, have you seen an increase of requests from clients concerning well and fit well projects?
I think our answer will be consistent here, but from my point of view, yes, definitely. I think the pandemic is one thing, but I think prior to that, there's been a lot of research, as Mohammad said, coming out about the positive outcomes from health and wellbeing on staff. Productivity is one, retention is another, just overall engagement with the organisation is another. So it's seen as a big improvement, and also something for businesses to promote to the wider world when they're trying to employ people. Staff now are aware of this, general public, that they want this out of an organisation that they work for. So people are starting to seek it when they're looking for employment or looking for an office space. They want to know that it's been designed with these kind of outcomes in mind. So when those kind of things are happening, the drive is massive for people to implement these things. So from my point of view, yeah, yes, definitely, it's seen a really large increase.
Thank you. Mohammad, on your end, would you like to comment?
No, I think Ben explained that really well. Yeah, the only things I want to add is what we've been seeing so far is, for instance, Well did put together a task force to respond to the pandemic. I just want to mention the fact that all of these certifications are evolving, and what I expect to see is in a year or two, we may see a different framework to this healthy building certification. Well added so many new elements related to social justice, social equity, and the community-related elements, which are important for healthy buildings. And I expect that to change and evolve and add more elements to it in the future.
Thank you. Fantastic. So we're at the end of our webinar session. Please feel free to follow up directly with Ben and Mohammad via the contact details shown on the screen. And I would like to thank all attendees today. Thank you for joining. And thank you, team, for a fantastic presentation. It was a pleasure to work with you.